Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 155, and today I'm going to be answering some more of your questions. But before I do, if you could do me a huge favor, click that like button. Really helps out my channel. And if you are not yet subscribed to the channel, go ahead and do that as well with notifications turned on so you don't miss any of my new videos. That being said, I just got back from a trip to Mississippi where I gave a keynote talk to one of those state organizations, really promoting best practices. That's the thing that I care most about. That way more individuals in the state of Mississippi can experience extremely high quality hearing healthcare with their hearing aids. But I was a little exhausted coming back because it was a really quick turnaround. Ended up getting back at like midnight and I got some sleep, so don't worry, I'm good. But let's go ahead and jump into your questions. The first question is from Ted Zick 7843. I swim a lot in the summer. Can I swim with the Lyric? Now, if you do not know what the Lyric hearing aids are, they are basically the only extended wear hearing aids that you leave inside of your ear canals 24 hours a day, 7 days a week for about 2 months at a time. You have to go into your hearing care professional's office every 2 months to have it taken out and have a brand new one inserted back into your ear canal because that's how long the battery lasts inside of those devices. But the concern here for Ted is that he is wondering whether or not he can actually take those hearing aids and go swimming or go into the water. Yeah, go swimming. Essentially, you can, you just don't want to submerge your head underwater. Now, I have had some individuals to where we can do a custom swim plug for their ears that they can put on top of their Lyrics, because when you think about it, the Lyric hearing aids, they go so far inside of the ear canal that you could technically still wear an earplug on top of them. Now, you are running the risk if you have any amount of leakage of water with those earplugs, it's going to get onto the device and it's going to kill the device potentially. Now, you can wear those hearing aids while you're showering. You can wear them in the pool without submerging your head. You can wear them in a hot tub. You can walk outside in the rain in those hearing aids without having any issues. But once you start submerging your head underwater, when water starts resting on essentially a microphone of the Lyric hearing aid, it is going to eventually kill it. Now, if you being able to go into water and not worry about killing your hearing aids, you really want to get a hearing aid that has an IP68 rating. That is the ingress protection rating. The 6 stands for debris resistance, the 8 stands for water and moisture resistance. When you have an IP68 rating, technically you can take a hearing aid, dunk it in a bucket of water down to like a meter for 30 minutes, pull it out, and it will still be functional. Now, I have seen water exposure kill IP68 hearing aids, but generally speaking, they are much more resistant. And I even mentioned this, I think it was last week or 2 weeks ago in my Q&A vlog, that the Phonak Audeo Life hearing aids are the only hearing aids that I have not killed with water. Now, I can kill the receiver of the hearing aid, but I can't kill the actual hearing aid itself because it like dramatically exceeds the IP68 rating. So if I were you, Ted, if I were you, I would be okay wearing the hearing aids while you're going swimming as long as, or the Lyric hearing aids while you're going swimming, as long as you're not submerging your head underwater, as long as you're not getting a significant amount of water splashed inside your ears. So if you want to play like water, or pool volleyball, you know, or things like that, generally speaking, you'd be okay. If you want an extra layer of protection, get a pair of custom molded silicone swim plugs by your audiologist or your hearing care professional to prevent as much water going into your ears as possible. But if you do that, you're not going to be able to hear very well. So you also have to keep that in mind when you're wearing the Lyric hearing aid. You're obviously wearing the hearing aid so you can hear better, and then if you put an earplug on top of that to prevent water damage, you're also going to prevent your ability to hear very well. So those are the considerations that you have to take into account when you're going to be wearing the Lyric hearing aids around a lot of water. The second question this week comes from Black Hawk Pilot. After 3 weeks, I am not happy with the ReSound ITE hearing aids. He said this video had streaming only to the left hearing aid. I think what he means here is that only the left hearing aid would stream audio. Checked both the system settings, iPad and Smart 3D. Both are connected to Bluetooth, but the right hearing aid just goes in and out. Well, Blackhawk Pilot, I am afraid that you probably have a pair of malfunctioning hearing aids. Now, I have had cases where it was actually the phone that was causing the issue, and I'll explain how I identified this, and you might want to test this too. If you have a significant other or friend who has a different phone, phone, pair your ReSound hearing aids up with their phone to see if you can get dual streaming with their phone. If you do, that means that the problem is not the hearing aids. The problem is your phone. Now, if you connect it up to their phone and you're also having an issue where it's only streaming to your left one and not to your right one, then chances are it's a bad Bluetooth antenna inside of your ReSound hearing aids. And this can happen with any manufacturer from time to time, especially if you end up dropping one of your hearing aids and dislodge the Bluetooth antenna. And then it's, sometimes manufacturer defect with these things as well. Bluetooth is a little bit finicky as well when you start getting down to the in-the-ear hearing aids, because they're trying to fit all of these different technological features inside of such a small device that all goes inside of your ear, instead of having a piece that goes behind your ear that leaves that Bluetooth antenna more exposed to get that audio signal from whatever Bluetooth device you're trying to stream from. So I would go ahead and try to do that troubleshooting first, see if that works. If it doesn't work, I would actually contact your hearing care professional, because they should be able to fix that problem for you. And the third question this week is an absolute doozy. This one comes from Margisser. I would like to know how dangerous cochlear implant surgery is. I've seen it done on YouTube, but don't understand how dangerous it is and the side effects. What I'll say is this: generally speaking, the surgical process is not very dangerous. I mean, it is an outpatient procedure. You basically get an incision behind your ear, they fold that over, they burrow into your mastoid bone here till they get to your middle ear space, insert an electrode array into the cochlea, sew everything back up, and you're done. I mean, that surgery can take as little as an hour or two. However, there are some post-surgical considerations for this. Now, first and foremost, the failure rates of cochlear implants, meaning after they implant it and the implant actually fails, are very low. It's something like below 7% or something like that, which means that chances are when they implant you, those cochlear implants are going to work. And if it doesn't work, they can go back in and fix it, and then it would most likely work on the second go around, but that does not happen very often. Second of all, there are risks associated with cochlear implantation when you consider the general anesthesia. So when people get put under to go in for cochlear implant surgery, if you have some other medical conditions, general anesthesia might be a little bit dangerous, but typically you're cleared from a medical standpoint before you go into cochlear implant surgery, so having any concerns about the general anesthesia is not much of a concern by the time you get under the knife. Now, there are other risks post-surgery that you might want to concern yourself about, but again, these are not extremely common. Let me just run through the list of some of them. This would include injury to the facial nerve, meningitis, cerebrospinal fluid leakage, paralymph fluid leakage, infection, blood or fluid collection, attacks of dizziness or vertigo, tinnitus, taste disturbances, numbness around the ear, and reparative granuloma. Now, I know that sounds like really bad because I just listed off a bunch of things, but you have to keep in mind here that these things are still extremely rare. In fact, in a 2013 study, they identified the three most common major complications were wound infection at 1.6% of the time, permanent chordotympany syndrome, which is 1.6% of the time as well, and electrode migration, misplacement, and accidental removal, which is at 1.3%. Permanent facial nerve paresis occurred following one implantation of the people that they studied, and this was only 0.3% of the individuals. Transient chordotympany syndrome, which was 30.8%, vertigo, dizziness was 29.5%, and tinnitus was 4.9%. These were the most frequent minor complications. Now, all of those that I just read off, the ones that were at 1.6% and 0.3%, obviously those are extremely rare. The ones that were on the higher of those percentages, like up in the 20s and the 30s, those are typically known as transient, meaning you might experience those for a period of time, but then they will typically go away. So if you're able to kind of handle that for a couple days to a couple weeks, I don't know, at the worst, maybe a couple of months, typically speaking, those will end up going away, and so you won't have to deal with them long term. Now, I spent a year working in a cochlear implant center, and the surgeon there did a ton of cochlear implant surgeries, and I think the worst thing that I ever saw was maybe that one of the devices failed and he had to go in and redo the surgery. That was one time over the course of the entire year. Now, maybe that has to do with the office that I worked at. Maybe that surgeon was just fantastic at what they did. But, you know, cochlear implants have been around for a while, and a lot of the people doing cochlear implant surgeries have a ton of experience. And I would venture to say that when you go to a cochlear implant surgeon, one of the things that you want to make sure of is that they know what they're doing. So asking questions to make sure that they have enough experience, ask them what these complications are before you decide to go in for surgery. But generally speaking, you can be relatively confident that whoever you go to who's going to be doing your cochlear implant surgery, they're going to be doing a good job. And as long as you follow the pre and post-op instructions, you'll probably be fine. That being said, there is always risks associated with literally everything. I just got back on a flight. Like I mentioned before, there was a small percentage chance that that flight was going to crash. In fact, when you get into a vehicle every day, there is a likelihood, there are a certain percentage of likelihood that you are going to get in a vehicle accident at some point throughout the course of your life. And I'm guessing that the risks of getting in a vehicle accident, a motor vehicle accident, are probably higher than having some serious health complication due to a cochlear implant surgery. With all that said, I do recommend that you have this discussion with your actual cochlear implant audiologist as well as your cochlear implant surgeon. And hopefully I did a good enough job calming your nerves about complications that can occur with cochlear implant surgery. Me personally, if I needed a cochlear implant, I would not think twice about going in and getting a cochlear implant for myself. And the same would be true if one of my family members was asking me for my advice on whether or not it was safe enough to go in and get cochlear implants. Hands down, yes, I believe that it's safe. All right, guys, there you go. I think this might be one of my shorter Q&A videos. I do apologize for that, but hopefully you liked today's video. If you did, go ahead and give it a thumbs up. And as always, I'll see you next week.